Have you ever wondered if the medication you're taking might be contributing to memory loss or cognitive decline? Many of us rely on various medications to manage our health conditions, but what if these very medications, meant to improve our quality of life, are also silently harming our brains? Recent research suggests that memory loss isn't an inevitable part of aging, but rather, it can be exacerbated by certain medications. The truth is, some seemingly harmless drugs can have severe effects on brain health, potentially leading to dementia and other cognitive disorders. The question is, are we truly aware of these risks? For many years, it was believed that dementia and cognitive decline were natural consequences of aging. However, advances in medical research have challenged this assumption, showing that memory loss is not a normal and unavoidable part of growing older. Dementia, including Alzheimer's disease, results from specific pathological processes in the brain rather than just old age. What's encouraging is that studies now suggest that it is possible to maintain sharp cognitive functions and even improve certain skills as we age, provided that risk factors are properly managed. There are numerous factors that contribute to maintaining brain health in our senior years. A balanced diet, regular exercise, mental and social stimulation, and the management of chronic conditions like hypertension and diabetes all play crucial roles. However, there are other, less obvious factors that can hasten or worsen cognitive decline. These include alcohol abuse, smoking, brain injuries, strokes, chronic insomnia, and persistent stress. Even nutritional deficiencies, particularly vitamin B12 and psychiatric disorders, have been identified as critical contributors to cognitive decline. The understanding of dementia has progressed significantly, with research highlighting the roles of tau and beta amyloid proteins, which form tangles and plaques in the brain, damaging brain cells. While genetics can predispose certain individuals to develop dementia, environmental factors and lifestyle choices also play a significant role in either mitigating or exacerbating these risks. This means that the development of dementia is not solely determined by one's genes. It can be influenced by the choices we make throughout our lives. Preventing dementia involves a multifaceted approach, promoting a healthy lifestyle, controlling chronic diseases, and medical interventions when necessary are all part of this strategy. Scientists continue to explore new therapies and interventions that might slow or even prevent the progression of dementia. Importantly, recognizing that cognitive decline is not an inevitable part of aging can inspire changes in our daily lives that promote brain health, potentially helping us avoid this devastating condition. Memory loss is a complex phenomenon with many causes, some of which might surprise you. While aging and neurodegenerative diseases are well-known factors, there are other, less obvious, but equally impactful contributors to memory loss. Substance abuse, for instance, can wreak havoc on the brain. Alcohol can cause direct damage to brain cells, while smoking contributes to vascular problems that impair brain health. Traumatic brain injuries, often resulting from accidents or contact sports, can lead to immediate damage or long-term cognitive problems, such as chronic traumatic encephalopathy. Strokes, which interrupt blood flow to the brain, can cause significant damage to memory and cognitive functions. Insomnia and sleep disorders also have a direct impact on mental and cognitive health, as sleep is essential for memory consolidation and brain repair. Chronic stress is another major factor, damaging brain structures involved in memory, like the hippocampus. Additionally, nutritional deficiencies, particularly of vitamin B12, can lead to cognitive decline, as can psychiatric disorders like depression and anxiety. Common medications that can damage your memory. Now, let's dive into the heart of the matter. Common medications that can adversely affect memory and cognitive function. These medications, while effective in treating various health conditions, can have significant, sometimes devastating impacts on brain health. 1. Anticholinergics, the hidden risk. Anticholinergics are commonly prescribed to treat conditions such as Parkinson's disease, overactive bladder, and even some forms of asthma and allergies. These medications work by blocking acetylcholine, a neurotransmitter crucial for memory and learning. Unfortunately, the prolonged use of anticholinergics has been linked to a significant increase in the risk of dementia and other cognitive disorders. A groundbreaking study conducted by the University of Washington revealed that individuals who regularly used anticholinergics had a 54% higher risk of developing dementia. The risk was found to increase with both the dose and duration of use. Some of the most commonly prescribed anticholinergics that have been associated with cognitive decline include scopolamine, meclizine, atropine, and oxybutynin. The implications of these findings are profound, especially for those who rely on these medications for chronic conditions. It's essential to weigh the benefits and risks of anticholinergic use and to explore alternative treatments where possible. 2. Proton pump inhibitors, PPIs, a double-edged sword. Proton pump inhibitors, or PPIs, like omeprazole, are widely used to treat heartburn, gastritis, and other acid-related conditions. While these medications are highly effective in managing symptoms, there is a growing body of evidence linking long-term PPI use with an increased risk of dementia and memory loss. For example, one study found that 10% of participants who took omeprazole for more than 3 years experienced memory loss. Another study showed that 33% of patients using the drug for more than 4.5 years reported cognitive disorders. This alarming trend may be related to PPI's impact on the absorption of vitamin B12, a nutrient critical for neurological health. Additionally, PPIs can alter gut microbiota, which has been increasingly recognized as playing a significant role in brain function. Despite their availability without a prescription, it's crucial to approach PPIs with caution. Indiscriminate use can lead to serious long-term consequences. Always seek medical advice before starting prolonged treatment with PPIs, and explore other options for managing acid-related conditions when appropriate. 3. Benzodiazepines, the silent threat to brain health. Benzodiazepines are a class of medications widely used to treat anxiety, insomnia, and certain seizure disorders. While they are effective in providing short-term relief, their prolonged use can have severe consequences for brain health. Medications such as alprazolam, Xanax, and lorazepam, Ativan, have been shown to double the risk of developing Alzheimer's disease. Over 40% of benzodiazepine users report experiencing neurological symptoms, including difficulty concentrating, lack of energy, and increased sensitivity to sensory stimuli. Furthermore, benzodiazepines can interfere with the sleep cycle, which is essential for memory consolidation. The relationship between benzodiazepines and Alzheimer's disease is particularly concerning. These medications may disrupt neurotransmitter functions, leading to long-term brain damage. For those struggling with anxiety or insomnia, non-pharmacological alternatives like cognitive behavioral therapy, CBT, and lifestyle adjustments should be considered as safer options. 4. Corticosteroids, more than just anti-inflammatory drugs. Corticosteroids are commonly prescribed to treat a variety of conditions, including asthma, allergies, and autoimmune diseases. However, these powerful anti-inflammatory drugs, particularly when taken orally and over long periods, are associated with serious adverse effects, including cognitive decline. Research indicates that corticosteroids can cause structural changes in the brain, leading to symptoms such as disorientation, confusion, depression, and anxiety. A significant epidemiological study conducted in the UK found that long-term use of corticosteroids for asthma management significantly increased the risk of dementia and other mental health disorders. The mechanism behind these effects may be related to the impact of corticosteroids on cortisol levels, which can interfere with brain function. Even inhaled corticosteroids, generally considered safer, can have negative impacts when used in high doses or over extended periods. Therefore, it is crucial for healthcare professionals to monitor corticosteroid use closely and to explore alternative treatments when possible. 5. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline and nortriptyline, were among the first medications developed to treat depression. While they have been effective for many people, they come with a side effect profile that includes memory loss and other cognitive issues. These medications work by blocking the reuptake of neurotransmitters like serotonin and norepinephrine, which can help improve mood. However, they also have strong anticholinergic properties, meaning they block acetylcholine, a neurotransmitter crucial for memory and learning. Prolonged use of tricyclic antidepressants has been associated with an increased risk of dementia and cognitive disorders. Given the risks associated with these medications, it's essential to consider safer alternatives. such as selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects and are generally preferred for treating depression. Again, any changes to medication should be done under the guidance of a healthcare provider. 6. Amphetamines. Amphetamines, including medications like Adderall, are commonly prescribed to treat attention deficit hyperactivity disorder, ADHD. While these drugs can improve concentration and reduce hyperactivity, their prolonged use, especially in high doses, can lead to significant adverse effects, including memory loss. High doses of amphetamines have been linked to permanent brain damage, decreased motivation, and overall cognitive performance decline. Moreover, amphetamines carry a risk of abuse and addiction, which can lead to additional complications such as cardiac arrhythmias and digestive problems. Given these risks, it is crucial for healthcare providers to monitor amphetamine use carefully. For those with ADHD, therapeutic alternatives and non-pharmacological approaches, such as behavioral therapy, should be explored to minimize reliance on medication. 7. First-generation antihistamines, a hidden danger in allergy relief. First-generation antihistamines, like diphenhydramine, Benadryl, are commonly used to relieve allergy symptoms, but their long-term use can have significant adverse effects on memory and cognitive function. These medications block acetylcholine, a neurotransmitter essential for memory and learning. As a result, prolonged use of first-generation antihistamines has been associated with an increased risk of dementia. This is particularly concerning given how widely these medications are used, often without a prescription. For those who rely on antihistamines for allergy relief, it is advisable to consider second-generation alternatives such as loratadine, Claritin, or cetirizine, Zyrtec, which have fewer adverse effects and are generally safer for long-term use. The potential for common medications to harm memory and cognitive function is a serious concern, particularly as we age. While these medications are often necessary for managing various health conditions, it is crucial to be aware of their potential impacts on brain health. By staying informed and working closely with healthcare providers, we can make better choices that protect our brains while still effectively treating our other health issues. If you are currently taking any of the medications discussed here and are concerned about their potential effects on your memory and cognition, it is essential to consult with your doctor before making any changes. There may be alternative treatments or strategies that can help mitigate the risks while still addressing your health needs. As research continues to evolve, we may gain even more insight into how to balance the benefits of these medications with the need to protect our brain health. In the meantime, staying informed and proactive is our best defense against the cognitive risks associated with these common drugs. Remember, your brain is your most valuable asset. Take care of it, and it will take care of you. Stay curious, stay informed, and most importantly, stay healthy.